Ji. Hi everyone, very good evening to all of you. Good evening. So we are here for the Obs and Gynae recall for your FMG exam that happened yesterday, and at the first go, let me just ask you, how was Obs and Gynae for all of you? Did you do well in the paper as far as Obs and Gynae is concerned? So lots of questions today to discuss. So we will not be doing a lot of teaching today, because I know you are tired and now you really want to know a quick recall, and that is what we are going to target. Yes, so everyone ready? Okay, so I'm waiting for just a couple of responses from all of you on how your paper was as far as Obs and Gynae is concerned. A lot of images as well, but I think most of them were directly from your classes. Yes, and they were very much doable. But yes, let me know your inputs, and then we are going to start with the session for today. Let's look at the first question. So this is a question which is, what is the first line management for a patient diagnosed with PCOS? Maybe the language is a little different, because I think the question mentioned the girl has hirsutism, or she also has irregular cycles, and especially they have asked you about first line. uh, Okay, yeah, they were specially asking you about first line treatment. So please remember, multiple times I've told you in classes as well, whenever we talk about PCOS, the first thing that we are going to do is lifestyle modification and weight loss. Do you remember what we have taught you? We have taught you that as little as a weight loss of 5 to 10%. Yes, it can regularize the cycles, as well as what it can even contribute to ovulation. Yes, so the initial advice is always going to be weight loss and lifestyle changes. Sometimes, yes, we might want to add OCPs to it, but when they are separate options and they're asking you first line treatment, we are going to stick to lifestyle modifications. Okay, perfect. Please remember, metformin is not given to everyone for PCOS. Okay, and clomiphene citrate again can be given for ovulation induction, but even for ovulation induction, what is the preferred drug? It is letrozole. Tick. Let's look at the second question. What is the earliest sign of pregnancy detectable on ultrasonography? I think they have specially mentioned about transvaginal ultrasound, है ना? So what is the answer? हाँ, अब बहुत सारे बच्चे आ गए हैं, so do let me know how was your Obs and Gynae paper as a whole, right? Were you happy with how you have done in paper 2 and especially Obs and Gynae? क्योंकि बहुत सारे questions आते हैं, it's always an important subject. So do let me know your inputs. How were your class notes? How was VFX? Yes, and especially I think a lot of things came from the predictor series as well, right? So जो मैंने कुछ ही दिन पहले किया था, I think just 3-4 days before the exam, the predictor series had a lot of hit rate. Yes, so do let me know. Yes, the answer here is going to be gestational sac. You're absolutely right. Gestational sac is seen how early? It can be seen as early as 4.5 to 5 weeks. I've told you the single best answer is 5 weeks. Yolk sac can be seen around 5 to 5.5 weeks. ठीक है? Fetal pole दिख जाता है, and cardiac activity around 5.5 to 6 weeks, where the single best answer is 6 weeks, right? So the first is going to be gestational sac. If you remember, I have taught you in detail the signs also. Which is the first sign? The first sign that you will see is intradecidual sign, which is nothing but a gestational sac with a decidual reaction around it. So that is what is a intradecidual sign. फिर कौन सा आता है? Then comes the double decidual sac sign. Yes, और उसके बाद कौन सा आता है? Then comes the double bleb sign. So these are again important things and you should know them. Okay, so then comes the double bleb. Remember double bleb में क्या होता है? कौन बताएगा? It was yolk sac and amniotic sac, है ना? So that is what is double bleb. So it is yolk sac along with amniotic sac. Perfect, very good. Are you ready for the next question? Okay, let's look at the next question. What hormone is detected by home-based pregnancy testing? So always we have said that whenever we want to know about diagnosis of pregnancy, the hormone that we use is HCG, and specially we have told you that we will use the beta subunit. Yes, do you remember the reason why? Because the beta subunit is the one which is specific. So you don't want any false testing, right? So we will do the beta subunit. Please remember the alpha subunit is absolutely identical to alpha of LH, FSH as well as TSH. अच्छा जल्दी से मुझे बच्चे याद करके बताओ, if we ask you HCG is functionally as well as structurally similar to which hormone, तो क्या आंसर दोगे? So if we ask you it is functionally and structurally similar to which hormone, then what will you say? Then the single best answer is luteinizing hormone, right? So these are the other important things. But yes, the answer to this question is B. Let's go on to the next question. What is the diagnosis? So this was a laparoscopic image. Now very very interesting. I have always told you, और मैंने ये class में भी दिखाया है, बताया भी है, you know, if you see a very clean pelvis like this, जिसमें कोई adhesions नहीं है, yes, there is no altered color there, right? It's a very clean pelvis. It cannot be endometriosis. Endometriosis will usually have altered color deposits. It will have a lot of adhesions, right? So what do you see here are kissing fallopian tubes. I know, you know, in a previous FMGE exam, they had asked about kissing ovaries. And kissing ovaries is actually endometriosis, but this is actually a case of kissing fallopian tubes. And there are also tubercles. So मैंने class में भी tubercles on the peritoneal surface of the on the fallopian tubes, uterus, वो images आपको दिखाए थे, right? So the answer is not endometriosis, okay? The answer is genital tuberculosis for this question, okay? So yes. So, and this is not hydrosalpinx as well, okay? Hydrosalpinx में tubes आपस में से चिपके भी नहीं दिखेंगे. They will be grossly dilated tubes, okay? So, as I said, this is kissing fallopian tubes. Kissing ovaries is endometriosis. Chalo, आगे बढ़े. Let's look at the next question. Again, a simple one, not a difficult one at all. Vaccine contraindicated in pregnancy. Yes, so the single best answer here is varicella. Can you tell me what are the other options that we have done? So remember, the ones that are absolutely contraindicated are MMR, yes, measles, mumps, rubella, as well as varicella. Yes, rabies can be given, influenza can be given if required. Yes, Tdap to dete hi dete hain, we all know. When do you give the first dose? So please remember, first dose of injection TD is to be given at the first antenatal visit, okay? And the next dose has to be given after 4 weeks. So after 4 weeks, you will give the second dose. Do you remember which is the only condition when you give only a booster? So वो तब देते हैं. So booster dose तब देना है when there is pregnancy within 3 years. Yes. So pregnancy within 3 years of a previously immunized pregnancy, right? So if it happens within 3 years, no, rubella was not in the option beta, it is rabies. Okay? So it is varicella. I think we have a very correct recall here. Okay? Everyone was saying it is varicella. Even if it was not, if it was rabies, then the answer would be rabies. But whatever recall we have collected through various resources, it you know, through my Telegram, through my WhatsApp, and yesterday's YouTube recall, they all said the option was varicella. Okay? Chalo. Now, this is another question where they have asked you what is the finding in the NST graph. Now, through my WhatsApp and my Telegram channel, this is the recall image that I have got. So, there were 2 images that students have sent me, and they were quite sure that the dip was coinciding. Yes, the dip was coinciding with the contraction. Majority of students said it was, there were 3 contractions and there were 3 dips which were absolutely coinciding. Some students have said that option A is correct. Some have said it was option B. But whatever it is, whether they gave you A or B, दोनों का ही answer early deceleration है. These are graphs of early deceleration, both image A also and image B also. There is a very small subset of students who were saying it was a graph of variable deceleration. See, in variable deceleration, the two things I've always asked you to remember is that there will be no consistent relationship to the contraction. Yes, sometimes variable will happen before, sometimes it may happen during, and sometimes it may happen after the contraction. So there should be no consistency with contractions. Second, variable dips have to be a quick dip and a quick pickup. Okay, rapid dip, rapid pickup. In graphs mein, the dip is not rapid, it is a gradual dip and a gradual pickup. So through whatever, yes, again, even in today's session as well, most of you are saying early, yes. So as I said, if it was image A and B, which is what maximum recall says, then these are graphs of early deceleration. Chalo, quickly tell me, what is the cause of early deceleration? Early ka cause hota hai head compression. Okay, variable ka cause hota hai cord compression. And what is the reason for late decelerations? Uteroplacental insufficiency. So these are the ones which are going to be associated with hypoxia, right? So in your exam, most likely it was a graph of early deceleration, at least majority of the recall says that. Yes, let's look at the next one. So this was a very simple one. I think everyone has done it right. So woman with hirsutism and ultrasound is shown and they have asked you the diagnosis. Everybody said, ma'am, PCOS tha. But yes, can you help me with the other three options as well? Anybody who can recall the other three options? Yes, so these are small sized follicles which you see in the peripheral arrangement. Yes, so there is a peripheral arrangement. These have to be small follicles. Remember, they are usually between 2 to 9 mm in size. And I've told you, as per the new criteria, what should be the number of follicles? It should be more than how much? It should be more than 20 now. So more than or equal to 20 follicles is the new criteria, right? Older wala tha more than or equal to 12. So let me see if you can just help me with the other options as well. Anybody who can recall the other three options, or I will just move ahead to the next question. Yes, can you recall? Yes, the answer is PCOS. Okay, so one of the options is OHSS, and please remember the biggest difference between the two is that in OHSS it will be big size follicles. Yes, it has to be big size follicles, and OHSS में the stroma is reduced, जबकि PCOS में it is the reverse, stroma is increased, right? So यहाँ पे stroma is increased. Okay. Anybody who can tell me the other two options? So one I've got, it is OHSS. Let me know what are the other two options as well. So let's move on to the next question. First sign of pregnancy on transvaginal ultrasound. Oh, I think it is a repeat. So we just discussed this. It is a gestational sac. I've just discussed this question a little while ago, which can be seen as early as 4.5 to 5 weeks. Okay, so this was a repetition. I will move forward now. Which drug, okay, will you give for carcinoma cervix? Hai na? So what were the options? Do you give immune therapy? Do you give hormone therapy? Do you give platinum therapy? Or do you give targeted therapy, right? So we all know the answer is platinum, right? So we give chemoradiation for all stages which are more than or equal to 1B3. Yes, we give chemoradiation. So a combination of chemotherapy and radiotherapy, and the preferred chemotherapy drug here is, yes, it is going to be cisplatin, which I told you is preferred over fluorouracil. Yes, so it is cisplatin. And do you remember which new immune therapy has been added? मैंने बताया था in advanced cases, especially when we talk about stage 3 and 4 cancers, which immune drug should be added? It is not replacing cisplatin, we add. It is pembrolizumab, right? So could be a potential question next time in your exams. Remember, now we are using pembrolizumab for carcinoma cervix, advanced cases, stage 3, stage 4. Okay? Chalo. Very good. Let's move forward now. Shoulder dystocia is when there is a delay in the delivery of shoulders after the delivery of the head. By how much time? So again, directly from your class notes, I shared the image as well. So more than 60 seconds. So when there is more than 1 minute delay, yes, in the delivery of the shoulders after the delivery of the head, then this is what is shoulder dystocia. Yes, it is 60 seconds. Do you remember the sign? So the sign that we have to look for is turtle sign. है ना? The sign is turtle sign. Quickly, what is the first maneuver? The first maneuver is McRoberts. And quickly, can you tell me, agar McRobert fail ho jata hai, then what do? You are going to give suprapubic pressure along with McRoberts. So if McRoberts alone fails, then you will do McRoberts along with suprapubic pressure. Yes? Okay. Chalo. Let's go forward now. And let's look at this. Which of the following cancers does not or is not protected with oral contraceptive pills? So remember, we've told you non-contraceptive benefits of OCPs. Yes, so please remember, OCP reduces the risk of ovarian, endometrial cancer as well as colorectal cancer. है ना? So कौन सा answer होगा? The answer is going to be breast cancer. In fact, you should remember that current use of OCP may slightly increase the risk. It may not be significantly increased, but it may slightly increase the risk. Okay, so breast cancer, definitely it is not prevented. Okay, so that is the answer here as far as OCPs is concerned. And you know, I've put new videos in Back to Basics for contraceptives. They are very short, very concise and very crisp. And I would recommend everyone to go through those videos in B2B. There is a video on OCP or hormonal contraceptives. There is a video on progesterone only contraceptives. Then barrier and pericoital methods, tubal ligation and intrauterine devices. So short videos, but very, very effective. So even if you're preparing for your next exam, you know, I would say they are a must do. So go through them, go to Back to Basics, go to gynecology, and then go to the contraceptive section. Okay, chalo, let's go forward now. The next question is the characteristic feature in ectopic pregnancy. So what is the classic finding in ectopic pregnancy? So it is, again, yes, this is exactly how we teach in the class, hai na? The uterus is empty. Yes, so uterus is empty, but you will see an adnexal mass. And what kind of mass did we say? Complex, hai na? So we will see a complex adnexal mass. And you may again, yes, see fluid in the pouch of Douglas as well, right? So the answer is going to be B. Remember, if you're seeing clearly a gestational sac with yolk sac, then this is a intrauterine pregnancy. And if you are seeing a thin endometrium, it may not be a pregnancy at all, or it may be a very early pregnancy. Okay? So the answer here is going to be B. I think yes, again, everyone has done it right. Let's look at the next question. So again, it's a very, very basic question, and you should not have got confused. मैं हमेशा बोलती हूँ, don't change your answer. Some of the बच्चास have changed. पहले सही mark किया था, फिर change कर दिया. Yes. Which one? This instrument is contraindicated in which condition? For use of outlet forceps. And I think the question clearly mentioned outlet forceps. Yes, the photo given was of Wrigley's forceps, but it mentioned outlet. So please remember, the answer here is obstructed labor. Okay, not in occipito-posterior, it's not contraindicated. OP mein you can definitely use forceps. Who told you it is not B at all? It is obstructed labor. Obstructed labor का मतलब है वहाँ पे जगह कम है, in fact बहुत कम है. Yes, so please remember, obstructive labor means there is severe degree of CPD. And there is no role of vaginal delivery here. And if you cannot do a vaginal delivery, can you put instruments? No, there is no point in putting the instruments. So I've told you that obstructed labor may, it is always going to be a cesarean section, even if the baby is dead. कुछ बच्चों ने क्या किया, obstructed labor mark करके then they changed the answer to cesarean section, and that's where you went wrong. In cesarean section, we can actually use the forceps blade to extract a head of the baby. So we use it like a vectis. So cesarean section mein we can use it as a vectis to extract the head. So answer is not cesarean, the answer is obstructed labor. ठीक है, so इसका मतलब what is the lesson learnt? Lesson learnt is do not change answers with your first instinct, because they are coming from your core knowledge, not from overthinking. ठीक है, so please अगली बार इसको आप change मत करना, go with your first instincts, and I'm sure that then you will be right in majority of times. Okay, let's look at the next question. So which sign of pregnancy is shown? So there is a bluish discoloration of cervix. We can see it in the vagina also, and we can see it in the vulva also. This is what is the Chadwick's sign. Yes, we all know Goodle's is softening of cervix. Okay, this is softening. Hagar's तो अभी आएगा, it was a separate question. And Osiander's क्या होता है? Lateral vaginal fornix pulsations. Yes, so lateral vaginal fornix pulsations are Osiander's sign. So Goodle and Hagar's are softening signs. They come early as 6 weeks, whereas the other signs come at 8 weeks. Signs of pregnancy मैंने हमेशा बोला है आएगा पेपर में, and you need to be good with those, right? Let's not do them wrong. A very good evening to everyone who's joining in now. And then yes, we've done it exactly like this in the class. I told you it will come as an IBQ, and it came. Yes, but it's an easy one. So which sign is shown here? It is the Hagar's sign. So we are doing a bimanual examination here. And what do you see here? Yes, your abdominal and vaginal fingers seem to meet. So when your abdominal and vaginal fingers seem to meet, we are touching this softer isthmus. So this is what is Hagar's sign. Yes, so Hagar's is softening of isthmus. Goodle's is softening of cervix. And Hagar's और Goodle's दोनों 6 weeks पे आते हैं, बाकी सारे signs 8 weeks पे आते हैं. Internal ballotment comes even later. It comes around 16 to 20 weeks. And external ballotment even later, around 20 to 24 weeks. Right? So these signs come later. Okay? So yes, it is Hagar's. No, not softening of cervix. Hagar's is softening of isthmus. Okay? Yes, so this is not Osiander's sign, beta. This is your abdominal fingers and vaginal fingers are meeting. That's exactly how I teach as well. Okay? Chalo. So again, a direct image from your classes. So I just got the class ka picture only. So this instrument was shown to you, and as you can see, the answer is balloon tamponade. So you had to identify the instrument. So this is a balloon tamponade, yes, which we use for management of postpartum hemorrhage. Yes, so we use it for management of postpartum hemorrhage when your uterotonics have been given and she still continues to bleed. So I have 3 options here. It's not for cervical dilatation, not for endometrial ablation, and if you can recall option D, then it is well and good. Yes, so it is an intrauterine balloon tamponade, exactly, used for postpartum hemorrhage. Okay, perfect, very good. Chalo, aage badhte hain. Okay, there was a very simple question. I haven't put the image, but they had given you a placental image, and they had asked you which side is shown. So the answer there was fetal side. Can you tell me why was the answer fetal side? Because they had shown you the attachment of umbilical cord. So they had shown you the attachment of the umbilical cord. So that's exactly, again, a direct image from the class itself. Yes. And also the fetal side, we have told you, looks smooth and shiny because wahan pe kya hote hain? There is membranes. It is covered with membranes, so it is smooth and shiny. So it was the fetal side. Okay. Yes, I will come to the questions. I have 35 questions, so hold on. Identify the stage. So this image was given, and it is half of the answer was there in the image itself. So they have given you the endometrium. Then they have given you early pregnancy and they are writing that there is a cavity there. Blastocele is there. The cavity is there. So when you see a cavity, it is not a morula. Yes, the answer is blastocyst. It's not an oocyte. It is a fertilized ovum. It's not zygote because zygote is the very early stage. Fertilized ovum is called as zygote. This has gone further. There is division now, right? So this is going to be best answered as blastocyst. This is the stage in which implantation will happen. Can you recall on what day? So implantation अगर हम पूछेंगे तो please remember it begins on day 6 and it ends on day 10. And blastocyst अगर पूछते हैं when is it formed तो answer है day 5. Yes, then the answer is day 5. Okay. Very good. Let's go forward. Identify. So again, a simple image. Yes, there is a defect in the spine and even the head is absent, right? So there is no formation of the head and there is a defect in the spine. You can see the entire cord. So this is not a spina bifida occulta. Occulta का मतलब होता है it is not obviously open, right? It is closed. So please remember this is an open neural tube defect. इसको क्या कहते हैं? इसको कहते हैं craniorachiasis, where there is a defect in the cranium also. So there is anencephaly also and there is an open defect in the spinal cord as well. So this is an open neural tube defect. It is not occulta. Occulta होता है जब वो open नहीं होता बेटा, ठीक है? So this is open neural tube defect will be the answer here, okay? Because craniorachiasis exactly option में नहीं था, all right? Yes, it is a type of obviously a neural tube defect. Quickly tell me what dose would you give to this patient in the next pregnancy? So because this is a neural tube defect, in the next pregnancy she will be getting a high dose of 4 milligrams up to 12 weeks, है ना? So she will receive a high dose of 4 milligrams up to 12 weeks. Okay, chalo, आगे बढ़ते हैं. There was a question where the patient, they said, was a case of obstructed labor and then she develops dribbling of urine after 7 days of post-operative period. Typically, that is exactly how I have taught you this in the class. So obstructed labor, she will present to you after 7 days of cesarean section with history of continuous leakage of urine, है ना? So ये directly class से, what is the answer? The answer is vesicovaginal fistula. Yes. Please remember the most common cause of VVF, especially in developing countries, I've told you, is obstructed labor. So most common cause of VVF, yes, in developing countries is obstructed labor. What was the answer for developed countries? For developed countries, bache, the answer was post-gynae surgeries, matlab iatrogenic, right? Especially if you are doing a surgery for malignancy, yes? And VVF may remember there is continuous dribbling. And now I want to ask you, will there be episode of normal voiding? No, there will be no episode of normal voiding. That is the typical history of the patient. ठीक है? चलो, आगे बढ़ते हैं. Now, there was a question in males, specially लिखा था male. In male, FSH is under the negative feedback of which of the following hormones? So, I hope आप estrogen नहीं mark करके आए हो. Yes, estrogen does a negative feedback, but not in the males. And even then, the most important answer for inhibition of FSH is the hormone inhibin. Yes, so the answer here is A. So even in males, even in females may be inhibin is one of the most important reasons for negative feedback. And that is why when you talk about post-menopausal women, inhibin कम हो जाता है, तो FSH बढ़ना शुरू हो जाता है. Yes, the answer is inhibin. It comes from the Sertoli cells. Males may it will come from the Sertoli cells. Females may it will come from the granulosa cells of the follicle. Tick. Testosterone, I'm sure we all know, is going to come from Leydig cells. Estrogen also comes from the female granulosa cells. The bigger the follicle, the more estrogen it is going to produce. Yes? Chalo, let's look at the next question. Which of these is abnormal in pregnancy? So the answer is diastolic. I have specially, even in predictor series, we have done all these questions. The predictor series itself had such a high hit rate. Yes, so diastolic murmurs are usually pathological. They can be physiological in 20% of women, but they are usually pathological. Okay, somebody is saying option D was progesterone. Okay, thank you for the inputs, but that's not the answer, hai na? So the answer is diastolic. Diastolic murmurs are usually pathological. S3 is physiological, split S1 is physiological, systolic murmur up to grade 2 is also physiological. Okay, the option was mid diastolic. Fair, that remains as the answer. Chalo, आगे बढ़ते हैं. Which drug is contraindicated in pregnancy? So this is very simple. What is the answer here? It is enalapril. We all know that ACE inhibitors are contraindicated. Along with this, और कौन से contraindicated होते हैं? Angiotensin receptor blockers, renin antags, ठीक है? Then beta blockers, okay? Diuretics, diazoxide, and even sodium nitroprusside. Right? So all these are contraindicated. Which is the drug of choice? The drug of choice is labetalol. Which is the safest one? Methyl dopa. Okay? So drug of choice is always to be answered as labetalol. Perfect. I knew you would do it right, so good job. Let's go forward. So 75% of iatrogenic ureteric injuries are due to gynecological procedures. Which hysterectomy has least risk? Again, something that I always talk about this whenever I am talking about prolapse, कि यही question आते हैं. Even in my NEET PG classes, I specially reinforce. Yes, the answer is vaginal. So please remember, the order is least risky होता है vaginal. उससे ज़्यादा risk of injuries is seen in abdominal hysterectomy. Then it is laparoscopic and robotic. Okay, so the least risk of ureteric injuries is in vaginal hysterectomy. We dissect off the bladder very clearly, so you're not going to cause injuries to the ureters. Okay, chalo, very good. I'm happy that you did it right. Excellent, good job done. We'll move forward. Okay, let's look at the next question. So again, yes, this we have done. First line management we said is lifestyle modification. So ek dobara aa gaya, we'll go forward with this. Let's look at this. So this was a question which says, after suction evacuation, the products revealed a karyotype of 46XX and negative result of P57 staining. So whenever you talk about, again directly from predictor series as well, मतलब class notes में तो सब है ही है ना? So when we say it is 46XX, we know it is complete mole. Partial mole is 69XXY. Yes. So remember, invasive mole is the most common type of GTN neoplasia, while choriocarcinoma is most common GTN after full term pregnancy. Okay, so after full term pregnancy, the most common GTN is choriocarcinoma, but otherwise it is invasive mole. Tick. Okay, beta P57 staining, especially we say it is positive in partial moles, and you shouldn't be confused. ये तो हमने किया था ना, partial moles are triploid. 90% of times they are triploid. Chalo, next question. There was a question on endometrial hyperplasia without atypia. What treatment are you going to give? What is the answer? Again, directly from your class notes, it has to be progesterone therapy. And even in progesterone, मैं कैसे लिखाती हूँ? Mirena is to be preferred over oral progesterones like medroxyprogesterone acetate. So Mirena क्या है? Mirena is nothing but a levonorgestrel containing intrauterine system or intrauterine device. Remember, we will not give estrogens if a woman has hyperplasia, right? So the answer is LNG. Danazol bhi nahi deti iske liye. So treatment of choice itself is progesterone. What is the treatment of choice with atypia? अगर with atypia आएगा अगले एग्जाम में तो treatment of choice is hysterectomy. Okay? हाँ जी, bleeding हो रहा है तो भी, right? You are not going to give estrogen to someone who has hyperplasia beta. So what you are going to give is progesterone therapy. Okay? All right. Yes. Okay. Incomplete. वो पहला recall मेरा वही था, but then somebody in the recall said no, it was not incomplete. It was invasive mole. तो इसलिए मैंने slash डाल के दोनों लिख दिया. But okay, incomplete mole था, but answer still remains as complete mole. Okay. चलो आगे बढ़े. Now, this was a very interesting question and a very basic one. There was a photo of a breastfeeding woman and you were being asked which hormone is responsible. Yes. What were the options? Options were oxytocin, TSH, FSH and growth hormone. So that's the recall that I got. And I'm sure we all understand this. The answer is oxytocin. It is the milk ejection hormone. Yes. And this is why the woman will also have what? ये भी हमने किया था discuss in the predictor series, right? So this is also the reason why the woman will have after pains. Which is the milk synthesizing hormone? Then milk synthesizing is prolactin, right? But milk ejection is oxytocin. Okay? So ये तो आसान था. I am sure everybody has done right. Let's move on to the next question. The snowstorm appearance was given and a diagnosis was asked. I'm not sure of all the options, but definitely the answer here is complete mole. Again, directly from predictor series. So snowstorm, which we said is also called as honeycomb, right? There is no fetus and there is complete hydropic degeneration. Yes. And ovaries में क्या मिलेगा? Ovaries में you will see bilateral theca lutein cyst. Okay, कोई बात नहीं. Maybe it was a question which was common पहले वाले के लिए confused था, where they have given you that after suction evacuation karyotype is 46XX. Okay, chalo. Let's move forward. So the question was, best tool or maybe what is non-invasive tool for assessing fetal anemia. Okay. So maybe somebody confused it with the question on 46XX. Okay. That's okay. So non-invasive or best tool for fetal anemia. What is the answer? ये भी हमने predictor series में किया. So the answer itself is MCA Doppler. Matlab, all these were anyways there in your class notes, but even in a short revision course that we did on YouTube free for everyone, predictor series, uska bhi bahut acha hit rate raha hai na? So yes, it is MCA Doppler. What do we measure here? Peak systolic velocity, PSV. What is the most likely complication? Now, can you, because I just have two options, so among these two options, it looks more like bowel ischemia, right? But can you tell me what were the other two options and if you can help me with the correct recall of the image? Yes, anybody who can recall, especially this one, what were the other options? Because I just have two options from the recall, and based on these two options and the history provided, I would say it looks like a case of bowel ischemia. There is chronic, constipation, and there is distension. So I would go with bowel ischemia, but yes, I need to know the other options for this one. So can anyone recall? Can anyone recall? Okay, let's see. If you can, then tell me. Okay, so then there was a question on best emergency contraception. So among the options given, the answer would remain as LNG. Okay, so please remember danazol and mifepristone are not approved emergency contraceptives. Okay, OCP is what is the USP regime, and it is less effective than LNG. So the answer will here remain as LNG 1.5 milligrams. It has to be given within 72 hours, right? So within 72 hours, and this is LNG tab. Okay, this is also the most commonly used. Okay, it is also the most commonly used emergency contraception. But yes, if in general we ask you best emergency contraception, then actually the answer is intrauterine device. And among hormonal, actually the best is ulipristal. But यहाँ पे दोनों ही option में नहीं थे, so the answer will be LNG. Okay. And remember, dose of ulipristal is 30 milligrams and it has to be given or can be given up to 5 days. That's the dose of ulipristal. Hanji. One option was colonic vessel hemorrhage. Okay, so they are saying one option here was colonic vessel hemorrhage. All right. Then another person is saying rupture of aortic aneurysm. But if I remember, if there is a ruptured aortic aneurysm, they would definitely talk about unstable patient. Nothing like that was mentioned in the patient in this question. Yes, did they talk about vitals? Yes, so please remember, if it is a ruptured aortic aneurysm, it is going to be an acute presentation and it is going to come with unstable vitals. So something should be mentioned. And a ruptured aortic aneurysm doesn't go with history of a surgical procedure. If we have done a surgical procedure and there was an aneurysm, we would definitely pick it up. Yes. So ऐसा नहीं है कि आपने कोई surgical procedure किया and you will miss on the aortic aneurysm that was lying there. So unlikely to be ruptured aortic aneurysm or colonic vessel hemorrhage. I would still stick to bowel ischemia, but yes, if you can provide me with the image, maybe in my Telegram channel or the FMG WhatsApp channel, then yes, let's see. But I'll stick to the answer as A as far as this question is concerned. Okay. All right. So we were talking about emergency contraceptives, and I said here the answer will be LNG tab. Yes. Yes, there was some history of a surgical procedure, may not be hysterectomy. So maybe it's a surgery MCQ, but because people, whenever you see hysterectomy, you think that it's an obs and gynae question. Yes, so you fire it at me. Okay, but yes, could be possible that it is simply a surgery question. She was a post-operative patient, and that is why I am saying the answer more likely is bowel ischemia. Yes, all right. So this is the next question. After undergoing vasectomy, yes, I know there is an image, but I could not get the image from anyone and nobody in the recall could provide me with the image. So if you can, it will be really great. Yes. For how long should additional contraception be continued? So this is going to be 3 months. Again, predictor series. I specially said that when you talk about tubal ligation, the major difference is tubal ligation is immediately effective, whereas in vasectomy, you have to advise for using a barrier contraception for next 3 months or 20 ejaculations. The best answer is 3 months. So many things have directly come from the predictor series itself. It is still available on the YouTube channel if you want to go and look at the questions and revise for your next exam whenever you get time. It is going to be high yielding. Yes. Then I think this is the last recall question that I've got. A mother with gestational diabetes mellitus gave birth. The newborn shows jitteriness, poor feeding and crying episodes. Yes, what is likely seen? Yes, so what is likely seen in the newborn? Absolutely, yes. So the answer is going to be hypoglycemia. It is not VSD bache, because the question says gestational diabetes. Gestational diabetes does not cause anomalies. So the answer is hypoglycemia. And I'm sure even in pediatrics, even in obstetrics, we've generally, routinely covered this. Yes, somebody is saying in the previous question, it was 3 months after vasectomy, visit to recheck. Absolutely, yes. At 3 months bache, we have to call the patient and document azoospermia in semen analysis. Only when you document azoospermia in semen analysis will you say that yes, it is now effective, and they don't have to, or no longer they would require a barrier contraception. Yes, that is how it has to be. So these were the recalls that I had from Obs and Gynae. If you feel that there is any other question, you can please let me know. But I think overall it was a good coverage and in-depth coverage. They've asked quite a lot of tiny things and concepts bhi पूछे हैं, कुछ images भी पूछे हैं. So I hope you have all done well, and I'm going to just wish you good luck for your results. And may God bless you all with success. आपका result बहुत अच्छा आए. This is what we are going to hope for. These recall sessions are just to allay, help you know what is the pattern of the exam, what are they asking, how much depth they are going into. Yes. So all the best, and I really wish that each one of you scores exceedingly well. Okay? And again, from the entire DAMS family, thank you so much for making us a part of your journey, and hoping to see so many of you on the other side, yahan pe mere saath on the hot seat to take your interviews. So let's look forward to that day जब आप बहुत एक खुशी का मैसेज हमारे साथ शेयर करोगे. ठीक है? So all the best. तब तक रिलैक्स करो, don't think about results, and I am sure कि अच्छा आएगा. ठीक है? So take care everyone, and thank you for joining in for today. Okay? Bye bye. See you everybody.